Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shephard, ministre de la Santé. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Dr. Russell. Can everyone please put your microphones on mute? Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît?
Good afternoon, everyone. Bonjour à tous. Just when it seemed like things were getting better and we're entering the last period of this pandemic, the game has changed again. And the game changer really is the variants. So the variants of concern of COVID-19, which have emerged in the last several months, are of concern. But here in particular in New Brunswick, we are dealing with the UK variant for several cases. The new strains, including the UK variant, are really daunting because it's a challenge to deal with, what we have been dealing with in the past, but now it's more infectious. So it's more easily transmissible and the virus is spreading quickly, and it is difficult to keep cases contained. Now, we were able to do it in Zone 7, so we know we have the capability of doing that, but currently in Zone 4, we are having some challenges there. So, and it is coming at a time when so many people are actually quite fatigued and tired of the restrictions that have been imposed on them by the pandemic and are really waiting for some sense of normalcy to return compared to what we've been living. And it's all relative in the sense that, we are fortunate to be living in Atlantic Canada. We've had much fewer disruptions in our lives compared to other jurisdictions. However, it is still a strain on the population and certainly in Zone 4 right now. So the new strain was first identified in the United Kingdom, and it's responsible for 62% of the cases that are happening right now in the Edmundston area in Zone 4. Slowing the spread of this requires a lot of interventions right now, but it also and targeted actions, but it also does require a renewed effort and cooperation and a new commitment to really seeing this through so that we can get to our end result, which is to have everybody vaccinated first dose by mid-June and second dose hopefully by mid-August. Ces nouveaux variants représentent un défi de taille. Ce virus extrêmement contagieux et facilement transmissible se propage si rapidement qu'il est difficile de limiter la prolifération des cas. Cette situation se produit à un moment où bon nombre d'entre nous sont fatigués des restrictions imposées en raison de la pandémie et attendent avec impatience un retour à la vie normale. L'éclosion qui fait présentement rage dans le secteur d'Edmundston est attribuable au nouveau variant qui a été relevé pour la première fois au Royaume-Uni. Ça fait plusieurs mois. Il faut prendre des mesures ciblées sur le champ pour ralentir la propagation de ce virus. Effective at 6 p.m. today, Edmundston and surrounding communities will transition to the red alert level. There's still somebody that's not muted. This is a circuit breaker, and it is designed to arrest the spread of the virus before it gets an even stronger grip than it has now. This measure will remain in effect for a minimum of 4 days. While we complete and assess the results of mass testing being conducted today and tomorrow, as well as the ongoing PCR testing directed by Public Health. Again, there's two different types of testing happening right now. The order will apply to the city of Edmundston and communities of the upper Madawaska region from, Segas, in the south, north to the Quebec border, and west to Maine. We are asking you to avoid traveling into or out of this area while the red alert level is in effect. The communities of Grand Falls, Saint-André, Saint-Quentin, and Kedgwick will remain at the yellow alert level. This reflects the present lack of cases in these areas and the concentration of new cases in and around the city of Edmundston. Depending on our findings, this measure could be extended and/or expanded to cover the rest of Zone 4. Edmundston et les collectivités avoisinantes régresseront à la phase d'alerte rouge à compter de 18 heures ce soir. Cette mesure coupe-circuit vise à mettre fin à la propagation du virus avant qu'il ne puisse renforcer davantage son emprise. Elle demeurera en vigueur pendant au moins 4 jours afin de nous permettre de terminer le dépistage de masse qui se déroule aujourd'hui et demain et d'en analyser les résultats et aussi les résultats des autres tests qu'on fait qui a été dirigé par ceux et celles qui sont en auto-isolement maintenant à direction de santé publique. Cette mesure s'applique à la ville d'Edmundston et aux collectivités de la région du Haut-Madawaska de Shigas au nord. À la frontière du Québec du Nord et à la frontière du Maine à l'ouest. Veuillez ne vous pas rendre dans ce secteur ou le quitter pendant que la phase d'alerte est au rouge. Les collectivités de Grand-Sault, Saint-André, Saint-Quentin et Kedgwick demeurent à la phase d'alerte jaune en raison du risque plus faible qui existe dans ces secteurs et de la concentration de nouveaux cas à Edmundston et dans les environs. Selon les résultats de nos analyses, cette mesure pourrait demeurer en vigueur pendant plus longtemps ou s'appliquer au reste de la zone 4. We will do what is required to slow the spread of this outbreak. The situation in Edmundston area developed rapidly over the last week. Nous avons annoncé 3 nouveaux cas dans la zone 4 lundi et 4 autres mardi. Nous avons annoncé 10 autres hier. Aujourd'hui, nous avons 24 nouveaux cas dans cette région aujourd'hui. Le nombre de cas de COVID-19 dans la région d'Edmundston a donc doublé et ensuite redoublé en moins de 2 semaines. On Monday, we reported 3 new cases in Zone 4 and 4 new cases on Tuesday. Yesterday, there were 10 new cases. Today, there are 24. The number of COVID-19 cases in the Edmundston area has doubled and doubled again in less than 2 weeks. We are investigating 3 unlinked chains of transmission in that area, and now we have confirmed cases of community spread, infections that we cannot trace to any previously identified case. And I just want to retrace that. So technically, what we have seen in other outbreaks is that it can take several weeks, several interviews to determine links between cases. So at this point in time, the cases that we are considering as community spread, they may in fact turn out to be linked in the weeks to come. And in fact, in the Zone 5 outbreak, it took about 5 weeks to determine that. The rapid spread of the virus has impacted the area's schools, daycares, workplaces, and sports venues. And the operational plans obviously require those facilities to be closed for a certain number of time. And sometimes it's because of exposure, sometimes it's because of staff self-isolating, et cetera. Healthcare services are under strain as well because of many staff who have to be in self-isolation at the moment. Puisqu'il se passe à la phase d'alerte rouge, les citoyens du secteur d'Edmundston doivent limiter leur contact aux membres de leur bulle d'un seul ménage. Ils doivent porter un masque en public, tant à l'intérieur qu'à l'extérieur. Les établissements de divertissement doivent fermer leurs portes et les restaurants peuvent seulement offrir les mets à emporter ou à livrer. Les centres de conditionnement physique, les salons de coiffure et les salons de barbier seront fermés. Je réalise que ces restrictions rendront la situation encore plus difficile pour les citoyens du secteur d'Edmundston qui ont déjà dû subir les conséquences de nos mesures les plus rigoureuses, dont le confinement complet au cours des 3 derniers mois. Je comprends, c'est vraiment, vraiment difficile et je comprends que les gens sont tellement fatigués à ce moment. Il est cependant d'une importance cruciale pour tous les citoyens du secteur de respecter les consignes de santé publique conçues pour protéger l'ensemble de la population. Même si vous ne croyez pas, même si vous ne comprenez pas, c'est très important. Si la santé publique vous a dirigé de rester à la maison parce que vous êtes un contact étroit, c'est vraiment important que vous le preniez au sérieux. J'implore directement les citoyens du secteur d'Edmundston de réduire leur cercle de contact au minimum. In moving to the red alert level, people in the Edmundston area are required to limit their close contacts to a single household bubble. Masks are mandatory in outdoor as well as indoor public spaces. Entertainment venues must close and restaurants can only offer takeout or delivery. Gyms, hair salons, and barbershops will be closed. I know this is a further hardship for the Edmundston area, which has already gone through our most stringent measures, including a full lockdown that happened in the last 3 months. It is vital that everyone in the area adheres to public health measures that are designed to keep us all safe. Even if you don't understand them, even if you don't completely agree with them, it is imperative that we all share the workload of trying to get this outbreak under control. So everyone does have to do their part. I am appealing directly to the people of the Edmundston area to reduce your close contacts, decrease your circle of contacts to the lowest number of possible, and follow very, very precisely the advice of public health when they are in contact with you. Wear a mask and maintain 2 meters of physical distance when you are out in public. And if you don't feel well, even if the symptoms are mild, stay at home and seek a COVID-19 test. Une clinique de dépistage de masse s'adresse aux personnes qui ne ressentent pas de symptômes et qui n'ont pas reçu la directive de santé publique de s'auto-isoler ou de subir un test à un centre d'évaluation. Alors, je vais juste répéter ça parce que c'est tellement important que vous entendez ce message et vous le comprenez. La clinique de dépistage en masse s'adresse seulement aux personnes qui ne ressentent pas de symptômes et qui n'ont pas reçu la directive de santé publique de s'auto-isoler ou de subir un test à un centre d'évaluation. C'est ça le dépistage en masse qui se déroule aujourd'hui à l'Arena de la Saint-Basile jusqu'à 18h et se poursuivra le vendredi de 10h à 18h. Il n'est pas nécessaire d'avoir un rendez-vous. Si vous ressentez des symptômes de la COVID-19, ne vous présentez pas à cette clinique. Appelez le 811 pour prévoir un test de dépistage à un centre d'évaluation. Aujourd'hui, la santé publique confirme qu'il y a 30 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il s'agit du nombre le plus élevé à une seule journée depuis 2 mois. En plus, il y a 24 nouveaux cas dans la zone 4. Il y a 5 nouveaux cas dans la zone 2 qui comprend les comtés de Saint John, Kings et Charlotte, qui sont tous liés à des voyages à l'extérieur de la province. Un nouveau cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne, qui fait présentement l'objet d'une enquête. Il y a présentement 89 cas actifs de COVID-19 dans la province et 635 personnes sont en isolement au Nouveau-Brunswick à l'heure actuelle. 3 personnes sont présentement hospitalisées après avoir contracté le virus. Mass testing for people without symptoms. I'll repeat that again. The mass testing is for people without symptoms and who have not been directed to either self-isolate or be tested at an assessment center by public health. The mass testing is for asymptomatic people who have not been told to self-isolate and have not been told to get a test at an assessment center by public health. So that testing is taking place right now until 6 p.m. at the Saint-Basile Arena and will continue on Friday from 10 a.m. to 6 p.m. and no appointment is necessary. If you do have symptoms of COVID-19, please do not go to this clinic. That is very, very important. We do not want people with symptoms to be lined up with people who are asymptomatic and obviously putting people at risk. So you need to call 811 and you need to arrange for testing at an assessment center. Public Health has today confirmed 30 cases of COVID-19 in New Brunswick, and this is the largest number we have reported in a single day in 2 months. In addition to the 24 new cases in Zone 4, there are 5 new cases in Zone 2, which is the Saint John, Kings, and Charlotte counties, all related to travel outside the province, and 1 new case in Zone 6, which is the Bathurst and the Acadian Peninsula. This case is currently under investigation. There are now 89 active cases of COVID-19 in the province, and 635 people are currently self-isolating. At this time, 3 individuals are in hospital. These New Brunswickers and their families need your support more than ever. I ask that you keep them in your thoughts and prayers as you go about your day. The measures we are taking today in Edmundston are strict, but they are absolutely necessary. And some people think, well, I've got my vaccine, or the vulnerable people have their vaccine in the long-term care facilities. Why do I need to continue to follow all these measures? Well, because it's the variant, number one, and number two, we do know that the variant does affect younger populations compared to the variant, to the strain that we have been dealing with in the past. So everyone needs to take this seriously. As you know, in places like Regina and other places across the country, the variant is putting people who are younger at risk of being needing hospitalization and in fact ICU admission. So please take this very seriously. We do need to work together to get through this. And my federal colleague, Dr. Theresa Tam, recently observed that Canada is now in a race between team vaccine and team variant. The variant strains are rapidly replacing the original version of COVID-19 in our province, and that is happening in other provinces across the country as well. And I think Saskatchewan went from 30% to 40% to 90% in just a few weeks. So since March 1st, 56% of reported cases are confirmed or suspected of being the UK variant here in New Brunswick. We have confirmed this in 23 cases recorded this month. Même si nous accélérons la mise en œuvre de notre programme de vaccination, nous devons continuer à faire preuve de vigilance à l'égard de ces nouveaux cas, des nouveaux variants, afin de donner le temps à nos efforts d'immunisation d'atteindre leur pleine efficacité. Ça ne va pas être réussi avant le mois de juin, mi-juin, et avec la deuxième dose, ça sera, on espère, mi-août. Si vous avez déjà un rendez-vous pour recevoir le vaccin à Edmundston, ne l'annulez pas. Alors, si vous avez le rendez-vous, allez-y, prenez le vaccin. Quand viendra votre tour, je vous supplie tous d'accepter le vaccin qui vous est offert. Ils sont efficaces et sécuritaires, y compris celui d'AstraZeneca qui a fait l'objet de reportages dans les médias récemment. Plus nous réussirons à vacciner de gens plus rapidement, nous serons en mesure de permettre au Nouveau-Brunswick d'atteindre un niveau d'immunisation sécuritaire. Bien que Santé Canada ait constaté des cas de caillots sanguins ou de saignements après l'administration de ce vaccin, ces cas sont extrêmement rares. Les avantages de ce vaccin surpassent de loin les risques. Et j'ai reçu l'information aujourd'hui, tous les reportages des événements comme ça dans le public général, dans la population, en nombre de bases des dernières années. Alors, s'il y a un changement de ces numéros, on peut comparer à ce qui existait avant. Even as we accelerate our vaccination program, we must remain vigilant against these new variants so that our inoculation efforts have a chance to take full effect. If you are scheduled for a vaccination in Edmundston, please do not cancel. When your turn comes, I implore everyone to take the vaccine that is offered to them. They are all effective and safe. This includes the AstraZeneca vaccine, which has been in the news in recent days. Health Canada has noted that while there have been some instances of blood clots or bleeding after receiving the vaccine, these occurrences are extremely rare. The benefits provided by this vaccine far outweigh the risks. And the more vaccines we can get into arms, the quicker we can get New Brunswick to a safe level of immunity. And as I just mentioned in French, I did receive baseline information for the last several years on any of those types of events that happen in the general population prior to the pandemic. So we do have baseline information to be able to compare that to. Despite all our efforts, we will see new outbreaks. This is already happening across the prairie provinces, and when required, we will use all the tools at our disposal to slow their spread. The most effective tool we have is public support for these vital public health measures, and I cannot stress that enough. It is really, up until now, it's been very, very successful, and it has been a collaborative approach, and it has worked up until now, and so we want to continue to see that success happen, even though we are dealing with the variant right now. So we just have to work that much harder. So now more than ever, every New Brunswicker has to play a part in slowing the spread of COVID-19 through their actions and by gentle encouragement of others to not give up hope. Si des membres de votre famille ou des amis habitent dans le secteur d'Edmundston, veuillez les appeler. Encouragez-les à rester forts et à continuer à faire preuve de vigilance. Faites-leur savoir que tous les citoyens du Nouveau-Brunswick sont derrière eux et les appuient en ces temps difficiles. La seule façon de réussir à traverser cette épreuve, c'est de travailler tous ensemble. Chaque citoyen dans tous les coins de la province doit contribuer à l'effort. If you have family or friends in the Edmundston area, please give them a call. Encourage them to stay strong and remain vigilant. Show them that all New Brunswickers are behind them and are supporting them in this challenging time. The only way we will get through this is by getting through it together, and all of us in every corner of the province. As tired as we are, we must all dig deep for the strength to push forward to the finish line. Thank you very much. Merci.
Good afternoon. Bonjour. As Dr. Russell has said, we have 30 new cases today, with the majority of those cases in the area of Zone 4, the Edmundston region. When we returned to the yellow alert level across the province, we said that if we had a rise in cases like we are currently seeing, or other causes of concern within a zone, such as the spread of a variant of the virus, we would not hesitate to move an area to another alert level. That is why Cabinet and the All-Party Cabinet Committee on COVID-19 has accepted the recommendation of Public Health to create at this time a short-term circuit breaker. We will do this by moving the area in and around the city of Edmundston to the Quebec border in the north, the Maine border to the west, and the south to Saigas, just north of Saint-Léonard, to the red alert level, effective as of 6 p.m. today. A map outlining the effective areas will be available on the Government of New Brunswick website and through our social media channels. This area will remain in red for a minimum of 4 days to allow for mass testing and further contact tracing to get a sense of whether transmission is widespread. If necessary, we will extend the time of the move to red or expand the area under this alert level to the entire health zone. A full list of what is required at all of the alert levels is available at gnb.ca/coronavirus under the COVID-19 alert levels. While the rest of Zone 4 will remain at the yellow alert level for now, we ask that everyone in that zone and across the province continue to follow the directions of public health so that the virus does not gain a foothold in other areas. Even as we take the quick and decisive action required to deal with the current rise in active cases, we are continuing our vaccine rollout across New Brunswick. On Monday, we began vaccinating 4,500 staff from high schools at clinics being held in 16 locations province-wide. Today, clinics are being held in St. John, with clinics taking place in the Tracadie and Moncton regions tomorrow, followed by clinics in the Shediac, Bathurst, and Campbellton regions on Monday. Schools will be closed to the students on the days that local clinics are being held to allow staff to be vaccinated and to plan for the full return to school. In the coming weeks, additional vaccination clinics will be available for staff in elementary and middle schools, including bus drivers and for early childhood service providers and the childcare staff as part of the larger employer section of the vaccine rollout plan. Yesterday, we announced that people 75 and older, rotational workers, regular cross-border commuters, and truck drivers are now eligible to book an appointment at a pharmacy for a COVID-19 vaccine. For people 75 and older, a caregiver or family member acting on their behalf can make the appointment. Rotational workers, regular cross-border commuters, and truck drivers must bring proof of eligibility to their appointment. You may not get in immediately, depending on the pharmacy you call, but you will be able to book an appointment. Please continue to be patient. Beginning today, People 40 and older with 3 or more select chronic conditions are now eligible to book an appointment for a COVID-19 vaccine at a clinic organized by Horizon Health Network or Vitality Health Network in April. Do not call a pharmacy to book an appointment if you meet this criteria. You can find a list of chronic conditions at gnb.ca/coronavirus under vaccines. Print a copy of the declaration form and register for an appointment at a clinic. And you can also register by calling 1-833-437-1424. I understand that everyone is anxious to get the vaccine, and I appreciate the fact that so many of you want to. But I ask that those of you who are eligible to be patient when you call a but I ask that for those of you who are eligible, be patient when you call a pharmacy or clinic to book your appointment. Pharmacists and pharmacy staff, as well as those working at the vaccine clinics, are doing an amazing job as they respond to questions while ensuring that people get vaccinated in a timely and efficient manner. If you are one of the eligible groups, know that you will get in for an appointment as quickly as possible. The light really is at the end of the tunnel. It's closer than ever. But as we've seen this week, this virus is not done with us yet. It is important that we continue to work together as we deal with whatever challenges arise. We have achieved so much by doing just that. Follow the directions of public health so we can continue to keep one another healthy and safe. Be patient, be kind, and know that everyone who wants to get a vaccine will receive one. Thank you. Merci.
Thank you everyone for your patience. We'll now proceed with questions from members of the media. Each reporter will have one question and a very quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Merci pour tout le monde pour votre patience. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is for Dr. Russell or Minister Shephard. On the list of complex medical conditions that are now eligible to receive the vaccine, it lists pregnant women who have 2 or more chronic conditions. Does that mean that the vaccine is safe for pregnant women in general to take? What's the latest information on the vaccine and pregnancy?
Those kinds of discussions should happen between the patient and their primary care provider or their obstetrician gynecologist, but certainly those people who, and again, it is a difficult decision to make, but at this time, we are offering it to, as you mentioned, pregnant women with chronic conditions.
Do you have a follow-up, Ms. Hogarth?
I do. Residents of Campbello who cross the border for essential goods have travel registration numbers. Some of them are wondering if that number allows them to be eligible for the vaccine, even if they only cross the border for essential goods and not to work.
At this time, we are still working with our age cohorts and the sections of individuals such as rotational workers and daily commuters, that sort of thing. So for right now, I would say no. We need to follow our guidelines and stick with our age cohorts and continue movement in that direction. It won't be long.
Thank you, Ms. Hogarth. Laura Brown, CTV.
Hi there. I'm wondering if there's any concern about the administration of the vaccine because of this outbreak. I understand that some of the pharmacists are actually affected. Their children were going to schools that were impacted. I'm wondering if there's any concern there.
So I can tell you that I think that any of the pharmacists that were affected were given the all clear this morning to return to work by public health. And that, we're going to continue proceeding with the vaccination clinics. We do have Horizon, Vitalite, and Extramural all hands on deck in order to do the testing that we have to do in Zone 4 in the Edmundston region. And so at this time, I think that they're managing.
Ms. Brown, do you have a follow-up?
Yeah, very quickly. Wondering if you feel like this testing is now coming too late. There was some concern by the member, the MLA for this region, that he requested testing on Saturday and was told no. And so I'm wondering if you feel like this mass testing is maybe too late.
I'm going to take that one, Laura. So from a public health perspective, each and every time we have an outbreak, we look at the settings that the outbreak is affecting, whether it's schools, long-term care facilities, et cetera, and whether or not there's community transmission, et cetera, and if we're missing anything. Most of the mass testing exercises that we've had up until now have not yielded very many cases. I think there were 2 in one of the earlier mass testing up when there was the Zone 5 outbreak in Hamilton and Dalhousie. So basically, I did actually have a conversation with one of the politicians on Saturday about that the first priority was to do the mass testing of the school population. That was the big priority, and I did explain that. So now we are moving forward with more testing at this time, but really there are two different populations that we're looking at, and I explained that as well. So we are looking at the population of between 500 and 1,000 people that public health has already identified as high risk. Those people should already be self-isolating at home for 14 days. The people for the mass testing, that is asymptomatic people who have not had exposure, and I cannot emphasize that enough, that if you've been identified as a contact or a contact of a contact, you should not be attending the mass testing clinic for asymptomatic people.
Stand by, Ms. Brown. Mr. Shepherd's going to answer as well. Minister?
Thank you. I just want to say that we have made every effort to be in close contact with our MLAs and our municipal leaders in the areas as this has proceeded. We had a noon call yesterday with the MLAs. We had another one today. We had calls to the municipalities both days, keeping them in the loop. It's really important that we do that and that they understand what's happening, and I believe we've been very diligent in that manner. I also want to say that I'm grateful for their help in delivering the message that we need their constituencies to go to the mass testing. Give yourself the comfort of knowing that you don't have COVID-19 or a variant, and we can get your community back to a yellow sooner than later. So thank you for that, and I appreciate all my colleagues helping us deliver that message.
Thank you, Doctor. Thank you, Minister. Maud Montembeault, Radio-Canada.
Oui, bonjour. Je vais avoir une question de suivi tout de suite après. Puis la ligne n'était pas super, alors désolée si je vous fais répéter. J'aimerais savoir, Dr. Russell, avec cette nouvelle éclosion, pouvez-vous confirmer si le Nouveau-Brunswick entre dans une troisième vague et à quoi cette nouvelle vague est-elle attribuable à l'origine? Par exemple, les déplacements avec le Québec ou autre?
Alors, ici, Nouveau-Brunswick et aussi dans toutes les provinces atlantiques, je crois qu'on n'a pas vraiment été parmi des vagues. C'était plutôt des éclosions ici et là, puis chaque fois, on a réussi à éliminer le COVID-19 chaque fois. Alors, je ne veux pas dire que c'est une vague, mais c'est certainement une éclosion qui nous concerne et qui nous inquiète parce que c'est le variant du Royaume-Uni est impliqué. Alors, c'était quoi la deuxième partie de la question? C'était si c'est la variante.
C'est attribuable.
Ah, OK. Chaque fois qu'on a des éclosions, c'est toujours lié à un voyageur, soit un voyageur qui travaille pour qui voyage pour le travail ou il voyage pour une autre raison. Alors, et chaque fois, c'est soit quelqu'un qui suit des directives de santé publique au niveau de l'isolement, auto-isolement, ou ça peut être quelqu'un qui a moins de restrictions parce que c'est pour le travail. À ce moment-ci, je veux juste dire que c'est un voyageur, c'est des cas liés à un voyage.
Comme il y a plusieurs similitudes avec ce qui s'est passé à Terre-Neuve, par exemple, c'est le variant, par exemple, ça touche les très jeunes. À quoi on peut s'attendre pour la suite? Qu'est-ce que vous anticipez en termes d'augmentation de cas et de flambée des cas dans les prochains jours?
C'est difficile à prévenir, mais je crois qu'on va voir plusieurs cas dans les prochains jours. Les bonnes nouvelles, c'est que les gens qui sont plus âgés dans les foyers de soins et les résidences à long terme sont protégés parce qu'ils se sont fait vacciner. Je n'ai pas le pourcentage exact de cette population, mais les risques pour cette population maintenant, c'est vraiment plus bas que c'était avant les vaccins ont été donnés. Mais la population qui est entre les âges même 29 à 49, on voit dans d'autres régions, d'autres provinces, ces gens peuvent être hospitalisés et même être obligés d'avoir des soins, une admission à des soins intensifs. Alors, on sait qu'il y a plusieurs gens qui sont protégés à ce moment-ci, mais on sait qu'il y a beaucoup de gens qui ne sont pas protégés. Alors, c'est pour ça que c'est tellement important pour que tout le monde dans cet endroit suive les directions de santé publique à ce moment-ci pour protéger ceux qui ne sont pas vaccinés encore.
Merci. Gilles Duval, TVA.
Oui, bonjour pour la Dr. Russell. Est-ce qu'il y a une confirmation que tous les nouveaux cas à Edmundston seraient reliés au fameux cas numéro 1 qu'on suspecte être du variant qui a éclaté la semaine dernière? Donc, est-ce que tous les cas pourraient lui être reliés?
Non, ils ne sont pas tous liés au même cas. C'est ça que je peux dire maintenant au niveau des détails.
As-tu suivi M. Duval?
Oui, est-ce que c'est comme la première fois qu'on met ce que vous avez appelé une mesure coupe-circuit, c'est-à-dire que seulement qu'une portion de toute la zone est visée par une restriction? Donc, on parle d'Edmundston et le Madawaska, on impose une restriction et pas pour le reste. Alors, est-ce que c'est comme une première fois que vous utilisez une zone pour faire une telle restriction-là?
I'll take that one. It is because of we're trying to be very sensitive about the Edmundston area in understanding that they have had, they have really borne a big brunt of the outbreaks in our province. We know that there is COVID fatigue. We also know that we have, at this time, an understanding of a containment to the greater Edmundston area. Now, with the mass testing and with our efforts with regards to the red in an area, we are hoping that the next 4 days will give us a better understanding of exactly where we stand with regard to the variant. So this is an attempt to get things, get a better understanding. We will be evaluating on the weekend, and if we need to go further, we will.
Merci, M. Duval. Merci, ministre.
Est-ce possible d'avoir un résumé en français pour la télé en français, s'il vous plaît?
C'est quoi la question encore?
Est-ce possible d'avoir la même réponse, mais en français pour la télévision en français, s'il vous plaît?
Je ne crois pas que ma réponse serait exactement celui du ministre. Je m'excuse. C'est au niveau le circuit.
Gilles, peux-tu répéter ta deuxième question vite pour le ministre?
Si c'était une première fois qu'on disait comme ça, là, comme on a fait en sorte que c'est Edmundston et au Madawaska qui est visé par des restrictions. Donc, je crois que c'est une première fois qu'on fait une sous-division dans une zone là, pour des restrictives.
Et c'est vraiment exactement la même chose qui a été fait à Halifax, à Nouvelle-Écosse, et aussi à l'île des Princes-Édouards avant Noël. Alors, c'est une situation nouveau. On veut vraiment éviter une grande éclosion, mais on veut aussi éviter des impacts négatifs sur la communauté. Cette communauté a déjà subi des phases rouges, des lockdowns. C'est vraiment difficile sur la santé mentale, c'est difficile sur les écoliers. Alors, on veut vraiment être précis avec nos mesures à ce moment-ci. Mais au fur et à mesure qu'on a d'autres informations, s'il faut changer jusqu'à toute la zone, on va le faire. Mais c'est vrai que c'est la première fois qu'on utilise ces mesures dans cette façon-ci.
Merci, M. Duval. Travis Fortman, Global TV.
Hi there. My question is for Dr. Russell. I'm wondering if we are at the point where we would categorize this spike in cases as a third wave, or the start of a third wave.
Well, it's hard to predict these kinds of things. I think we are looking at more cases in the days to come. Obviously, anytime there's an outbreak, it does take several weeks to get it under control, as has been the case each and every time we've had outbreaks. Obviously, the biggest surge we've had was after Christmas. I think when we consider the language around these cases right now and the number of cases, it is concerning, and it's most concerning because it is the variant. So, across the country, I know they have been referring to this third wave as being related to the variant. I will just say that it is we're looking at a surge in cases. I am very concerned because this surge in cases is related to the variant. The variant is extremely transmissible, and we are seeing more negative impacts on the health of younger people in these types of situations. So in places like Regina, where they are having a surge in cases related to the variant, I think 90% of their cases are variant right now, and we are seeing younger people requiring hospitalization and ICU admission. So not only is it more transmissible, meaning more people can become infected in a short amount of time, but younger people who are exposed and get COVID-19 can become ill and require hospital ICU admission very quickly. We are seeing that they get admitted quickly and they recover quickly, but it is a risk and a problem right now that we're very concerned about. As you know, we've vaccinated a lot of long-term care facility residents and healthcare workers and nursing home residents and healthcare workers. So we feel good about the fact that that population is hopefully protected at this point in time. But again, there's a whole sector of the population. I think in total right now we have 8.3% of the population in New Brunswick that's vaccinated right now. So it is a concern.
Mr. Ford, do you have a follow-up?
I do. Again, for Dr. Russell, this time I'm wondering if you could give us the latest on this neurological disease you've been hearing about and what you might say to New Brunswickers who have been reading the headlines and panicking a bit.
Well, what I can say is that we have a large team of people working on this right now to investigate first and foremost. We have an epidemiologist on our team that's working with Public Health Agency of Canada. They're working with the surveillance folks at the national level. We are working with a neurologist here in the province, and we're working with other government agencies right now that can have input into further investigation. So there will be no stone left unturned at this point in time. And the memo that went out recently in the last few weeks was really around notifying healthcare providers, because the way that things are reported, it could be reported to the surveillance system for Creutzfeldt-Jakob-like illnesses, but also we do need it reported to public health. So we want to capture all the cases to make sure that they're all included in our investigation.
Thank you, Doctor. Thank you, Mr. Ford. Marie Sutherland, CBC.
Good afternoon. My question's for Dr. Russell. Can you explain what's going on in Zone 4, why cases are still increasing, why we were able to get Zone 7 variant cases under control more quickly? What are the differences, basically?
Well, the variant does transmit very quickly. Each and every outbreak is unique in terms of, the risks and the transmission and the circumstances. So obviously, most outbreaks start with a traveler, whether it's work-related or otherwise. It's either somebody who was allowed to not have to self-isolate completely or work isolate or be tested, or it could be somebody who was supposed to be self-isolating, thought they were self-isolating correctly, and unfortunately were not. We are seeing that in this particular outbreak there are more public exposures, but the settings that people are we're finding the transmission in when our public health nurses are investigating is places where food is consumed. So there is transmission happening there. Again, it's every outbreak, every surge in cases is different, and because of the nature of COVID-19 in this particular variant, it can be unpredictable in terms of how quickly things happen. The more aggressive our contact tracing can be, and the more stringently people follow public health measures, then obviously that's going to be helpful in getting this particular surge under control as soon as possible. So again, I think that people are tired, people are fatigued, there's no question, and in particular that particular zone, because they've been in lockdown before in the last several months, it's very exhausting. So I think that is also a challenge. So not only are we dealing with a surge in cases that's related to a variant, but it's happening at a time when we don't have the population fully vaccinated, and it's at a time during the pandemic when people are very tired. So we do need to dig deep right now, and we do need to really collaborate and work very, very hard together to get this outbreak under control. That means people with symptoms getting tested. That means people staying home and self-isolating when they're told to do so by public health. And again, I know nobody wants to be doing that, especially when the weather is nice, but it is really necessary to protect the population up there. As I mentioned, we are comfortable with the fact that there are vulnerable populations that have been vaccinated in the nursing homes and long-term care facilities, but obviously there's a large amount of the population that is not protected at this moment in time. And in other jurisdictions across Canada, they are seeing hospitalizations and ICU admissions with the variant. It is more transmissible, and it is actually causing more need for hospitalizations.
Ms. Sutherland, before we get to your follow-up,
Minister Shephard would like to comment.
Thank you. I just wanted to also mention, if my memory serves me correctly, that zone was also, I think the province was completely orange at that time. So we had a little bit less contacts, public and contacts with people. And so I'm sure that played a big role in containing it.
Ms. Sutherland, your follow-up, please.
Okay, thank you. Also for Dr. Russell or Minister Shephard, given what you've just said, Minister Shephard, would you be considering then making the decision to roll back to orange or red sooner in the future? Or are you going to be looking at changing the criteria given the rise of variant cases and how quickly those surges can happen?
I'll start, and then maybe Dr. Russell might want to add something. But for us, I know that I have to tell you, public health, they work every single day and many, many, many hours of the day. And every morning and every evening, they have briefings. And so they're assessing the situations. I know Dr. Russell is on calls with her counterparts all across the country, and public health are also with on calls as well with colleagues. The province, the chief or the medical health officers are in constant contact daily with Dr. Russell and the Department of Health. And so it is fluid. It will remain fluid until we get herd immunity. And we will be diligent in monitoring every situation and making the decisions that we have to make going forward. Do I see that today? I don't think I see that today, but we will certainly monitor all of the situations every single day.
And I just want to support what Minister Shephard said, and also going back to the fact that the Zone 7 outbreak took place when we were in orange. That's a very good point. I think for the public health folks out there, we would love to see, more measures that keep people as safe as possible, but it's always that balance between having people have the ability to live a certain way and have contact with their family and friends, knowing that the variant's there and it can arrive at any time. So everywhere around the province right now really needs to be focused on this outbreak in terms of what it means to their community if it were to happen there. So maybe be a little bit less permissive with some of the choices that you're making and hunker down now to avoid what's happening up north.
Kevin Bissett, Canadian Press. Danielle Edwards, Canadian Press. Savannah Odd, Telegraph Journal.
Hi, my question is for Dr. Russell. You said that cases in Zone 4 doubled and doubled again in 2 weeks. Given that the variant is much more transmissible, why did public health wait for 2 doubled counts to bring in mass testing or go back to a stricter alert level? Why not act sooner?
Our decisions around triggers and making recommendations really involve 3 different categories. So it's not just about the doubling time, it's about the settings that we see cases happening, it's about hospital capacity, and whether or not we have the capacity to contact trace and test as aggressively and as in a timely way as necessary. So up until recently, we had been staying on top of all of the contact tracing. I think what we have been missing in that area is compliance with public health measures. So that is one of the problems that has been impacting this outbreak. Again, people are tired, they're fatigued. The variant is a new virus altogether in terms of our what our experience has been and what we need to do to address it. So yeah, that's.
Ms. Odd, do you have a follow-up?
I do. Thank you, Bruce. I'm wondering if you could tell me how many active cases of the variant there are in Zone 4 today, and how many people are now in isolation because they're a close contact to a variant case?
Well, half of the active cases in the entire province are in Zone 4. Of those, 30-odd active cases are We do have those numbers because we do send all of the information. We have our ability to do preliminary testing here, so we can say that they're most likely the variant, and then they get sent to the National Microbiology Laboratory in Winnipeg. So right now, the active cases, there's 58 active cases in the Edmundston area. And the proportion of those that are variant, my understanding is there's 28 in total, but I don't know which ones, if they're all, if all of those are in that 58, but I can find that out. And in terms of self-isolation, my understanding is there are 635 people that are self-isolating right now. But again, your question was, of the active cases in Zone 4, which there are 58, you wanted to know how many of those 58 are variant. And I don't have that exact breakdown at this moment, but I can get it. Okay, and in terms of self-isolation for the education department, roughly 1,100 students, 50 early learners, 200 school personnel, including teachers, support staff, and supply staff, have been asked to self-isolate with their families as contact tracing is carried out within the region.
Oui, bonjour. Ma question est pour Dr. Russell. En fait, j'aimerais savoir, avec l'augmentation du nombre de cas dans la zone 4, je sais que vous avez déjà dit non à cette question-là, donc j'aimerais savoir si vous considérez encore de vacciner de façon massive dans la zone 4 pour, dans le fond, prévenir d'autres éclosions dans cette zone-là.
Certainement, à ce moment-ci, on va continuer avec les vaccinations qui étaient planifiées déjà. Et si on pourrait augmenter le nombre de doses de vaccins à cette région, c'est quelque chose qu'on peut discuter. Mais à ce moment-ci, on va juste continuer avec les vaccinations qui a déjà été déterminées. Mais certainement, les camionneurs, les travailleurs rotation et ceux qui traversent la frontière chaque jour sont compris dans les gens qui vont être vaccinés.
Tu es suivi,
Oui, merci beaucoup. Donc, toujours pour Dr. Russell, en fait, avec la situation qui a été mentionnée aujourd'hui de plusieurs pharmaciens dans la zone 4 qui ont dû s'absenter, qui n'ont pas pu donner de vaccin aujourd'hui, est-ce qu'on considère les rendre dans un groupe prioritaire en ce moment parce qu'ils ne sont pas admissibles pour le vaccin présentement?
Il y avait des discussions déjà qui se passent déjà ce matin. Alors ça, c'était déjà été réglé et communiqué aux pharmaciens et pharmacistes. Et vraiment, l'information que j'ai, c'est qu'il y a plusieurs des gens qui sont des pharmacistes qui ont déjà été vaccinés parce qu'on savait que c'est eux qui vont faire donner les vaccins. Alors c'était important de leur protéger.
Merci, Mademoiselle Brassard.
Merci.
Meg Cunningham, CHMA.
Thank you, Bruce. My question is for either Dr. Russell or Minister Shephard. Both Moncton High School and Mount Allison University have confirmed a case of, confirmed a case of the variant in their communities, but only one variant case has been accounted for publicly in Zone 1. Can you confirm that there's only one confirmed case of the UK variant in Zone 1, or is there more than one?
I don't have any more updated information than that, so I can only confirm one.
Okay.
Follow-up, Ms. Cunningham?
I do. As of this morning, multiple pharmacies in Zone 1 were booked solid with vaccine appointments due to lack of supply. How many people now qualify for the vaccine, and how many doses have been made available to pharmacies?
Well, I guess what I can tell you is that every vaccine we've received dose-wise is out or allocated. And so I think we're getting about 24,500 Pfizer each week now. We are getting out of our numbers for Moderna, and the AstraZeneca was already allocated. So the groups that are, of course, are ready to qualify are 85 plus, 80 plus, rotational workers, daily commuters, truck drivers. We have, who else do we have here? We have healthcare workers and allied healthcare professions now. So as we are rolling out, we are utilizing our numbers. I'm sorry, I do have a chart, but I don't have it with me. But that's how we are making the announcements of those who can now make appointments for their vaccinations, as we are basing it on the numbers that we know. And so while a pharmacy may not have the doses for the phone calls they receive, we are anxious to tell everybody that they don't have to go to their regular pharmacy. They can continue to call other pharmacies and make appointments as they are available.
Thank you. Meg, do you have a follow-up?
I've asked 2 questions already.
Oh. I tried.
Thank you, though.
Aiden Cox, CBC.
Thanks. This question is kind of similar to the one Ms. Cunningham just asked, but we've heard some pharmacies aren't getting enough vaccines for older age groups before younger ones are added. How are you ensuring that each pharmacy gets the right amount to avoid a backlog of people waiting?
Well, we can only give out the amount of vaccines we have. But as I've just stated, we're basing our announcements on who qualifies for vaccines, based on the average numbers that we have for the categories we are talking about, and on the vaccine supply that we are receiving from the federal government. So we can only put out the vaccine we receive, and the vaccine is received one day. It is out for distribution to pharmacies or the RHAs the next day, and that is a rotational effort that it continues on, and we can only put out what we get.
Aiden, do you have a follow-up?
Yeah, this one, at the last briefing, you indicated the 4 provinces would be giving more thought to coordinating and aligning border policies for the Atlantic bubble so that people visiting from different regions won't have to deal with different requirements for each province. What, if any, progress have you made on that front?
I haven't had an update from the Premier's office this week on that. I know that there were some conversations that happened. I know there was a joint statement, and then I know that Nova Scotia changed their policies 24 hours later. So I can say that we're going to make every effort to coordinate our policies, but that's still in the works. And with regards to New Brunswick opening their borders, we've slated for, I believe, April 19th. So we still have a bit of time to, do that work.
Thanks.
Thank you. Before we close, Dr. Russell, Savannah Odd, Dr. Russell has some additional information for you.
Yes, so currently we have either confirmed or suspected UK variant in 62% of the cases in Zone 4. So that's the answer to your question, Savannah.
Everyone, that concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup tout le monde.